This should be brief. This is stuff that I think most of us know. I'm just going to show you a couple of pictures here. I have no disclosures. It's going to give you some gross anatomy of the aorta. I prepared presentation notes, but then I thought maybe I know enough about the aorta to just wing it, I hope. And really I'm just going to show you a couple of pictures. Incidentally, since I like etymology, I'm sure Dr. Barnhart has something clever to say about that. People may or may not know that the word aorta is a Greek derivative that comes from a word meaning to lift or to rise. So the aorta, let's see here. Oops. Okay. The picture on the left here, you can see arises from, left ventricular outflow tract behind the right ventricle, sandwiched between the right atrium and the pulmonary artery. And this top-down view, just to get a view of the root, is composed of a trileaflet valve in this picture here, connected to the aorta with fibrous tissue called the annulus, and has a space here from the annulus to the sinotubular junction called the coronary sinuses, and has two associated origins of coronary arteries, the left and the right here as well. Okay, this view shows the thoracic portion of the aorta with the heart in situ here and explanted here on the right, and showing that the ascending portion is the shortest branch, transitioning to the aortic arch, giving off three branches of the innominate, the left common carotid, and the subclavian. It has a long descending segment giving off branches to feed the upper extremity and the thorax. Before going through the aortic hiatus, giving off additional branches in the celiac, SMA, renal arteries before bifurcating into the iliac arteries, providing the blood flow to the abdomen. I think it's also important to know in cross-section, the aorta has three different layers. The important layer for us, I think in further discussion, would be the media, which unique to the aorta has a higher burden or composition of elastic tissue, allowing for distensibility in systole and recoil in diastole, becoming less elastic over time and also predisposing to some of the diseases that we'll talk about today. So that's that.